As we look inside Pinellas County, Florida, we find a thriving vacation land of more than 921,000 full-time residents and another 5 million annual overnight visitors. Yet more than 12% of Pinellas County residents live at or below federal poverty levels. More than 20% of the population is uninsured, another 10.3% is unemployed, and nearly 6,000 people are homeless. The healthcare needs of this economically vulnerable group are the concern of Pinellas County Health and Community Services, a department of the Board of County Commissioners. Collaboration with community partners is key to allowing health and community services to provide efficient health care countywide. One very visible and representative program utilizes 10 medical home sites, like this one at the Florida Department of Health in Pinellas County's Mid-County location.
When clients come here, it's a patient-centered type of model, which means the patient is looked at holistically. In addition to receiving the primary medical care services, they also receive preventive services. There are several people who have chronic diseases such as diabetes, obesity, high blood pressure. It's important to learn how to manage those diseases, again, to keep yourself healthy, keep yourself out of the emergency room, and be able to take care of yourself and your family.
Prevention really pays off. You want to keep people out of the emergency room where care is very expensive. What we find is that for every dollar that you put into prevention, there's been a study at the Robert Wood Johnson Foundation, you get $3 in benefits in terms of the health of the community.
For those patients who can't come to a specific clinic location, Pinellas County offers the ultimate doctor's house call with a mobile medical unit.
We go to recovery centers and places where homeless people eat their meals or receive services otherwise, places that homeless people are familiar with so that they're comfortable coming to the van and seeing our people on the van.
We treat people with acute and chronic illnesses, injuries. We have a lot of patients that have hypertension, diabetes, COPD. We do skin care, wound care, things of that nature. We give limited immunizations to try and help keep the homeless healthier.
They really are great people. I can't say enough good things about them. They've made sure that I've had everything I need to make sure that my health problems are taken care of.
Work will soon begin on a new medical clinic for homeless families, funded through a $5 million grant through the Federal Department of Health and Human Services, Health Resources and Services Administration.
We have seen lives changed, we've seen lives saved. When somebody comes and they've got something wrong, don't know what it is, if we can get them the diagnosis, perhaps for something as serious as cancer, we can also provide the treatment and perhaps even save their life.
Promoting healthy communities, a collaborative effort among healthcare partners. The Pinellas County Health Program with 10 medical home sites. Homeless services and programs. Veteran services with emphasis on services for homeless vets. The Family Housing Assistance Program. Expanded dental care with the Pinellas Oral Health Coalition. Behavioral health care access, and the mobile medical unit. These are just a few of the ways Pinellas County Health and Community Services brings health care to everyone.
If we can improve the status of the community as a whole, the community thrives, people become self-sufficient, people are kept out of the emergency room, the whole community is healthy and better for it.
It has been said that the measure of any community is in how it treats its weakest, most vulnerable members. In this community, that measure begins with adequate health care for everyone. That's what we find as we look inside Pinellas.